Thank you. Thank you very much. First of all, I'd like to thank the organizers for having me here. It's a real privilege and an honor to be among not only doctors but also among the defense forces. This audience is very special because it's because of all of you, the defense, that we are happy, safe, and healthy. And as it happens that my presentation is also going to be talking about how the immune system, that the body's defense, ensures that we are, whether we are healthy or unhealthy, whether we are sick or we are, resilient or strong. So all of these things which the immune system does for us is thanks to you. And today the science is really completely talking about how, even in situations, the conversation that we are having about obstetrics and gynae, that how the immune system comes into play and how we can manage things through the gut microbiome, our immunity, which is where most of the 80% of the immune system resides, and how that connects with outcomes in pregnancy. So really, it is a pleasure. And what I plan to do is to connect this whole area of gut health, the microbiome, to gynecological problems. I will talk about I'll put the spotlight on two common conditions which include maternal obesity and polycystic ovarian syndrome, PCOS. And through that, I will make the presentation in a way that you can make, literally join the dots and extrapolate that information to almost every condition that one sees in terms of complications in pregnancy and in women. So the topic is nourishing well-being with gut health, microbiome, and inflammation reduction in obstetrics and gynecology. So, like I just said, the burden of maternal obesity is actually growing, and what is interesting is, and what is also disturbing is that it's happening more in the lower income groups, and it's a coexistence of maternal overweight or obesity and child stunting in low income countries, which is far more disturbing. And of course, I'm not going to share data here on the fact that we have about 11.1% in the world people, women are overweight, and pregnant women are overweight. And the interesting thing is, why is this happening? And the causes typically that we know are, we understand the calorie concept, we understand the beliefs and the other environmental factors, and some of them are the non-modifiable factors. So since this is really not the scope, I'm not going to dwell too much on this. But like I said, in the lower income group, calories and energy consumption is far lower. So obviously there is a gap. That obesity is really not all about calorie in and calorie out equation. And had it been, then even otherwise, obesity rates would not have climbed the way they have. And there is so much information, and we are also burning so many more calories in gyms today. Almost like 1,000 calories are being burned by many people, 2 hours, and diets could be 1,000 calories, 1,200 calories, and yet they're not getting slimmer. So this equation really has not worked. And what is really the actual, what matters is what are the quality of calories and how you're dividing those, and how your gut environment is, how the microbiome is behaving. Is it in your favor? Is it against you? So I'll be talking about all of that. And now we have enough evidence to suggest that maternal obesity is associated with dysbiosis. Dysbiosis is something which is an imbalance between the good and the bad flora in our system. This could be bacteria, fungus, virus, whatever, and some others. These, when they when the good ones are in our favor, it is a symbiotic and a happy relationship. When they get disturbed, when the bad ones are more than the good ones, it is a state of disturbance and dysbiosis. And these are the specific some names of the bacteria which are connected with obesity: bacteriotides and firmicutes. So this ratio is very important. The firmicutes should be are usually lower in people who have dysbiosis and obesity, and increased levels of bacteriotides, low levels of lactobacillus, etc., and lesser diversity is also very important. The number of the kind of bacteria and flora that we have should be more diverse. So this is very clear today, and how this impacts the leaky gut and the whole concept of food sensitivity. And we know that this is a reality. I will talk more about it a little later. Malnutrition also, because when our gut flora is disturbed, the absorption of our nutrients and micronutrients gets compromised. And today we are seeing a big burden of micronutrient malnutrition among the well-heeled and the obese as well. So it's not only the undernutrition aspect. So we have three kinds of malnutrition. Well, I won't get into that, but essentially just to highlight that anemia continues to be a big problem in among the women and children. The statistics have not changed since 70 years, since many intervention programs to eliminate or eradicate anemia have been initiated. And so I think the answers really lie in the gut, and whether we are really in a state of good balance of bacteria or imbalance, which is what is going to determine the absorption of nutrients as well. And this dysbiosis also leads to oxidative stress, inflammation, and insulin resistance. We've already spoken of, we've had the speakers before me talk about complications of preeclampsia, etc. So I'm not going to dwell at all on that. Essentially, the point that is being made here is very clear, that we are seeing the role of the gut microbiome in almost everything, whether we are going to make it or not make it, whether we are going to be absorbing our nutrients or not, whether we are going to be able to fight or not. So these, the coming slides will explain it. Now, say for instance, polycystic ovaries. This is again a huge 1 in 4, or whatever the figures today are. It's really growing, and we are seeing earlier we thought that polycystic ovaries was only with obese or inactive girls and women. Today we are seeing absolutely thin girls who are suffering from PCOS. We are also seeing it at much later ages, even after babies. Women are coming with cysts, etc. So there is a data which is suggesting 5 to 15% of women are suffering from this, which is really, it's growing. And it is, again, a chronic state of inflammation and insulin resistance. And these are the two hallmarks. And of course, what it is associated with, this audience does not need me to spell out. And obviously increasing the risk of diabetes and metabolic syndrome. And it is also what we call a pro-oxidant, pro-inflammatory state that exists independent of excess fat. That inflammation is triggered by glucose ingestion, is associated with, there's other way of increasing inflammation is because of excess insulin or insulin resistance. And of course, it is also associated with oxidative stress and inflammation, which promotes hyperandrogenism. Diet-induced inflammation may directly invoke hypoandrogenism, and superimposed excess adiposity augments the inflammatory load. So what is common? I mean, really, both the conditions that we've spoken about have all the hallmarks of the same things. They're talking about, inflammation. And so in PCOS and in maternal obesity, the mechanisms involving the gut microbiota may be a potential pathogenic factor. Microbiota composition in PCOS patients differs from healthy controls. and I've just shared that imbalance with you. Studies suggest that obesity, insulin resistance, hormonal imbalance could lead to dysbiosis, and of course, I'm going to talk more about it shortly. Modulation of the gut microbiome through diet is a potential PCOS treatment. And this is really not coming as a surprise because Hippocrates, the father of modern medicine, 2500 years ago said all diseases begin in the gut. But somewhere, I think, with modern medicine, we lost that concept and we started treating individual organs. And this is the 4G. It also happens to be the title of my book, The 4G Code to Good Health. And it's the 4Gs are gut, girth, gluten, and glucose. And essentially, what is common between the gut and the girth? It's the same area, is a reflection. When the girth is large, it's a reflection of some kind of adiposity in the internal organs. And it is all modulated by the gut, and glucose and gluten are some of the key inflammatory components. So these are all inflammatory. They are being threaded together by one is the trigger, the food is the trigger, and the areas where they impact is the gut. And what is this microbiome? These are over 100 trillion microorganism inhabitants that together possess 150 times more genes than the human genome, and thus today should be considered as an organ itself. These are little tiny bugs. We all understand how microscopic they are, but they almost account for all 2.5 kgs, 2 to 2.5 kgs in our body. And they reside all over the body, but predominantly in the gut. And they hold the key to our lives in every which way. Even if we say we have a genetic predisposition, these microbiota can actually, because they have their own genes, and with the human genome, they interact to literally to modulate which gene is going to be expressed and which is going to be silenced. So even if you have a gene, genetic predisposition, a gene for developing such diabetes or polycystic ovaries or breast cancer or whatever, it requires the environmental triggers, and these bacteria can actually help you. So today they say we are more bacteria than human. They say it because this is actually true. So when we eat, we have to ensure that because the food that we eat is impacting the microbiome directly. So we have a whole, we are literally on the driving seat to control how these bacteria are, whether we are in a state of dysbiosis or symbiosis. So this is how the science has panned out. And there is something known as the estrobolome, which is basically the gut microbiome, which control and metabolize the estrogen, circulating estrogen in our gut. And this is now, these are very emerging areas, new areas, but there is enough evidence to ensure that, suggest that this is where it is all happening. So that means our estrogen, progesterone, etc. are also being regulated by these microbiome. And this specific group is called the estrobolome, which has been found to regulate estrogen levels and its metabolism. So we just spoke about dysbiosis, and dysbiosis, I call it the 4Ds, leads to deficiencies, disorders, and diseases. That's the 4Ds. And if you look at the gut integrity on the left in this slide, the cells are shown here. On the left are tightly packed, and on the right they are open and they have gaps. So if you see that on the left, it is like our borders. I mean, this audience will understand this better than anyone else. So if we have porous borders in our country, we have infiltration of wrong elements, and that's exactly what's happening in the gut. So the barrier is broken, and undesirable toxins, etc., are going into the blood, and sometimes even partially digested food is going into the blood, which is triggering the antibody production, which is which is triggering our immune response, our defenses to produce antibodies. So if I'm not able to fully break down my food and there is a gap in my gut, it is going partially undigested into the blood, which is invoking a huge inflammatory cascade, which is obviously going to cause problems when it happens on a regular basis. So this science is really absolutely critical for all of us to understand. And if you can see here, it is going to lead to malabsorption. It will lead to autoimmune problems because autoimmunity also begins with inflammation, food intolerances. So suppose I am not able to break down the molecule of, say, egg or the or milk protein or wheat protein, and if it's going into the bloodstream, it is going to cause food sensitivities. That's why the number of people with food allergies has really sprung up. And then this has the capacity, these inflammatory cytokines can actually cross the blood-brain barrier, causing neurological and psychological and psychiatric problems. And of course, low-grade systemic inflammation, which can be affecting you in any part of your body, any vital organ, depending on your genetic makeup. So this mucosal architecture that you can see here is key and critical to managing all that we have spoken about. Zonulin has been found to be a protein in the gut which gets triggered with dysbios when there is imbalance of what we call bacterial overgrowth, or with the exposure to gluten, which is a protein in wheat. And this opens up when you have zonulin secretion. It basically ensures that the gut the gut integrity is maintained. But with the increase in zonulin, we have the opening up of the tight junctions, and that is very clear now. And this paper is, there are several papers today which are talking about the role of zonulin in opening up or causing the leaky gut. And dysbiosis and lipopolysaccharides. Now these are again like bacterial exhaust, toxins of the bacteria in the gut, which when they because there are the gaps, when they cross over, it's called what endotoxemia. It gets into the systemic circulation, causing severe chronic inflammatory conditions. So these are things that we are seeing. There is a lot of evidence here. Even things now, we've talked about what are the triggers and what are at the microbial level. Even some of the appetite controlling, we're talking about obesity here. Appetite controlling or regulating hormones, almost 8 of them are found in the gut, are secreted in the gut. So if there is a state of dysbiosis, certainly your control of food intake, your cravings are going to get impacted negatively. So ultimately, what is the problem is inflammation, which is starting because of an imbalanced gut flora. And the biggest trigger of inflammation is the food we eat. So you can imagine how much we can modulate our lives by simply the right choices. This, of course, we've spoken about multiple micronutrient deficiencies, and some of the common ones include iron and folic acid, B12, D, selenium, zinc, iodine, magnesium, manganese, calcium, etc. What is very interesting here is that since we are talking about obstetrics and gynae, that if a pregnant woman is eating a food which is causing a leaky gut, in any case, please, everyone must understand that hormonal changes will affect the gut integrity. As a matter of fact, they say that the 3rd trimester of pregnancy, the gut microbiome is like an IBD patient, inflammatory bowel disease patient. So it's that bad and that disturbed. And if the woman is eating foods which are causing antibody production, say for instance against wheat, these have the ability to cross over through the placenta to the baby even before the baby is born, and also crossed over through the breast milk. So that is basically something about we're talking about how we can, through food and nutrition, deal with these. So let's understand what are the conditions, what are the foods which can really impact our gut happiness, or the state of the gut microbiome. So I have divided these because we all understand nutrients. Otherwise, I love to talk only in terms of food. But here it's broken up into carbohydrates, proteins, and fats, just for ease of categorization. So too many sugars, too much of high glycemic food, or too much of food and certain kinds of sugars. We all understand the FODMAPs, right? The fermentable oligodisaccharide polyols. So these are also triggers which disturb the gut microbiome. Certain sugars do that. Proteins, certain proteins like in wheat and certain other grains, milk protein, and too much of animal protein and processed meats. And fats can also trigger inflammation. The trans fats, of course, everyone today understands, which are found in reused oil or in margarines and bakery fats, which are made with margarine. And excessive amounts of polyunsaturated fat is also, it can trigger inflammation. So that, plus there are other, specific specific foods which are in this. I thought that was another slide. Maybe that's, yeah, here. So things like maybe not having enough good amount of fiber, phytochemicals, and processed meats. Of course, we've already discussed that. So what are the causes of this biosis and leaky gut? Besides food, there could be other causes as well. We've talked about the diets, excessive alcohol, too much medication, antibiotics, chemicals and pesticides, and the air pollution and all the toxins around us, infections, poor digestion, low stomach acid, aging and stress, and vaccinations can profoundly impact the gut microbiome. So this is, I'm going to skip this, but just to tell you that if we are talking about wheat here, wheat sensitivity can be manifested as wheat allergy in the form of celiac disease or non-celiac. You don't have to be a celiac to have wheat sensitivity. It's called non-celiac wheat sensitivity, and in the form of FODMAPs. So we won't get there. Just to mention that for anyone who is trying to work towards improving the gut microbiome and limiting wheat or cutting down on wheat or eliminating it, there are other grains which mimic wheat, which also need to be put out, like corn, soya, oats, and some others, which I'm not going to spend too much time. So ultimately, how do we manage these conditions, these inflammatory conditions? First, manage inflammation, have an anti-inflammatory, gut-healthy diet, manage your weight, customize a diet, of course, an active lifestyle and sleep, high on nutrition and antioxidants, and addressing critical nutrients like calcium, magnesium, vitamin D, iron, folic acid, and iodine. Now, this is already been discussed, so I'm not going to go further. But yes, personalized diets, customized diets are the way to go forward. And we need to make assessments and, of course, provide prebiotics and probiotics. Something which I wanted to share, since we're talking about diet, we all understand a healthy diet in general. But butyrate is a fuel for we spoke about the broken gut lining or the leaky gut. And somehow with the modern science, we eliminated our gut-friendly fats, which are so rooted in our tradition, like butter and ghee and even coconut oil. That works in a different way, but butyrate is actually fuel for the gut lining. And then there are anti-inflammatory fats. Magnesium will also be very important, a missing nutrient in all this narrative of the obstetric and gynae conditions, improves insulin resistance and pregnancy outcomes and preterm labor, etc., etc. Vitamin D, I'm sure everyone is aware of, is a very powerful anti-inflammatory vitamin. So I'm not going to go with the specifics now because we're running out of time, and I do have some case studies, which, if you permit me, I would. Yeah? Okay. Okay. So this is the key takeaway, that prioritizing gut health during pregnancy is essential for nurturing both mother and the baby. A healthy gut lays the foundation for a thriving journey through motherhood and women's well-being. And without exaggerating, I think I would love to say that the grain change with a happy gut could very well be the game changer. And with the year of millets, which the Honorable Prime Minister has declared, this message is becoming much more amplified and much more acceptable. Now, there are a lot of studies here. I have just put them down to support everything that has been said. If anyone's interested, I would love to share this particular one with you. This was a girl, a woman who came at the age of 43 after suffering. This is about infertility, basically relating the microbiome with infertility, miscarriages, etc. And this was her last attempt, and every IVF she was gaining weight. So she came to me just to lose weight, to manage her weight, so that the fourth time she was going to be going through the IVF, she would be a little lower on weight. And I looked at her file. She had malabsorption, she had iron deficiency, and I mean, the entire picture told me that we had to work on the gut. And she agreed. We did the elimination diet, and this time her pregnancy was, I mean, the IVF was successful, and she conceived twins. And she came back to me and said, but I'm not going to take any iron because I don't tolerate iron. She already had a very disturbed digestion. So I said, okay, if you're going to follow the diet to the T and not contaminate with the grains which I've told you to put out, let's see how things go. And everyone knows here that there is a physiological anemia of pregnancy anyway, and her hemoglobin was 8. And guess, in the third trimester, her hemoglobin without any iron was 12.5, carrying twins. So this just shows that if we have to modulate our nutrition and our well-being, it is through the gut and through the grains, and the choice of grains has to be very, very carefully done. And she delivered with no complications, and she had a very bad family history. She didn't get any hypertension or gestational diabetes, nothing. And this particular one came to me with severe grade 3, grade 4 endometriosis, to the point that her life was, for 15 days before her period, she used to be on a drip. And the whole house, she was in a joint family, had to work around her time of just another minute and I'll finish. So this was a very, very, abnormal and severe case of endometriosis, and the doctor had told her, we'll have to do treatment, and we'll have to work at maybe just get rid of your uterus and all of those kind of things. And she had been under treatment of a gynae, and also she had history of miscarriages. And when we worked on the diet, we only gave her a gut-friendly anti-inflammatory diet, and within 3 months, she normalized her dysmenorrhea. I mean, entire endometriosis issue resolved even on the scans. And I don't know how she is today, but for that whole year that we monitored her, she was back to normal life, no drips, no pain, and then she had a baby again later. And well, this is a PCOS case, but maybe I'll just take another minute, sir. Yes, I will just finish with this one, just to amplify that these are not only in literature, in research, but in clinical practice. One sees them all the time. And this particular girl, a lady who came to me at 34, was a hypothyroid patient, had just delivered, and her baby was extremely colicky. And when she came to me, she said, I can't sleep day or night because of this colic, and I'm very depressed and I can't lose weight. So when I saw the history of autoimmunity and as a hypothyroid, I said, maybe you're giving something to the baby through your breast milk, because she was exclusively breastfeeding. And I changed her atta. In 1 week, she came back and she said the baby doesn't have colic anymore. And the next week, then she said, but the constipation remains, which she had not reported to me. So I said, well, if you change your milk, let's see how the baby responds. The constipation in the baby was so severe that the baby would pass motion once in 3-4 days, and sometimes 7 days, sometimes 10 days. So you can imagine how severe and uncomfortable the baby was. So I said, you will stop taking dairy milk for this week, and it was a big step for her, but she did it. Yes, I'm finishing. And we just removed the milk, and we took away the wrong grains, and the baby started passing motion, almost 10-12 motions in a day. They couldn't handle it. And there were celebrations, and every time in the family, literally, that the baby is passing motion. And every time she ate wrong, the baby would be constipated the next day or and had colic. So these are just clinical experiences which I thought I must share. And pardon me for exceeding the time, but I'm going to finish with this. And thank you very much once again for your attention and for having me.